I am doing the assessment of the GI system on my daughter Fatima Toure. As you can see her head is about 30 to 35 degrees. Her knees are bent and she is laying down. I will be inspecting her stomach area from the neck down to her waist area. I will be listening. I will percuss. And I will palpate first, then I will do a percussion. So I will be inspecting, listening, palpate, and percuss. You see her knees are bent, as you can see. Her arms are on her side, and she already urinated before I start this test. As I watch her stomach, I have already seen her stomach. Her stomach is round. It's soft to touch as I try to touch her. She did not complain of any pain and discomfort. Do you have any pain, discomfort? Do you move your bowels frequently, regularly, no straining? She answered. She denied pain and discomfort. She moved her bowel regularly every day and no straining. With my stethoscope, I will listen to her bowels and I will do it on the 4 quadrants. I look at the belly button here, which is the umbilical cord. I will check 1, 2, 3, 4. Listen to all the 4 quadrants. And I want to know, are they active? Are they hyperactive? If they are, I will have to note it. For some patients, down the lower quadrant is sometimes diminished or even absent. That's somebody that is obstructed, but she is not. Therefore, my daughter's bowel sounds are active and they are present on all 4 quadrants. With the bell of my stethoscope, I will be listening. That is under the breast, coming down a little way with the bell. I will be listening like almost close to the under the breast for the aortic. I'm listening for any bruit, the sound. After the aortic, I will be listening around the kidney, which is around here. Then I will be listening by the side or by the rib cage for the kidney to if I can hear any bruit too. After listening to the kidney below the rib cage, I don't hear any sound. So I will have to say there's no renal stenosis had on my daughter. Then I will listen to her iliac area. The iliac area is where I will be listening for any bruit. And if I don't have no bruit in the iliac area, which I will come down a little bit below the aortic to listen to the iliac area. And if I don't hear any bruit on the femoral, then I know the femoral is good. Now I will be palpating the stomach. As I start to palpate, I will be palpating all 4 quadrants. I will try to start easy as I palpate the stomach. Then I can able to go a little bit deeper as I palpate for any discomfort and tenderness. When I go deep, I will have to put another arm on top. But right now I'm holding my phone. So the other arm will come on top. Then I will go a little bit more deeper on all the 4 quadrants and I will check for any pain, discomfort, or tenderness. After that, I will be doing the hooking technique. I will be using my fingers that I will go below the rib cage. I have no nails here, as you can see. Then I will go below. I will ask the patient to deep breathe. Breathe deep. Breathe for me, please. And then I will try to see if I can catch the liver. And because of our liver is good, I can feel it and it comes out from me. It does not allow me to able to catch the liver right below the rib cage. And under this left breast, I will be checking the spleen. And I will be doing almost the same thing with the spleen again. And because of I'm doing for the spleen, I will say the liver is not palpable. And then the spleen under the left breast area is not palpable too. Then now I will be doing the percussion. The percussion is I will do again. I will be pounding put my arm like this, and then pound on top of this my arm, on top of this my finger, to see the other arm gonna be the one pounding on top of arm. So like my arm gonna be like this, another one pounding like this on all the 4 quadrants. I don't have somebody holding the phone, that's why. My daughter's abdomen is tympanic, and the sound that I had on all the 4 quadrants, even below, is almost the same sound, as loud as the ones on top. As I palpate for the liver, I will be doing it from the mid-clavicular line up by the lungs. Then I will be palpating again. Sorry, because I'm palpating with this arm. If I should be 2 arm when I'm doing palpation. So I will palpate until I hear a dull sound. Then I will use the tape. Then I will start down by the belly button, the umbilical cord down, and then I will palpate again, coming up. Then when I hear a dull sound, that is where it ends. Then I will put another tape. Then I will measure. So when I measure, if it's around 5, 6, or 7, 8 centimeters, that's normal. And that means my daughter's liver is not enlarged. Because that is why I'm doing this. I palpate from the lungs area here to where the dullness starts, then from the umbilical cord coming up to where. I put a tape here, I put a tape, then I measure to know. I will do the same for the spleen. I will check for the dullness. It's around the 6th and the 10th rib where I will be palpating again. And the anterior line, I will be doing on the anterior axillary line around here, which I will be percussing. And I will do it around the 6th and 7th rib cage. And if I feel any dullness, that's where the spleen is. So I will be going around the 6th and 7th. Where the dullness is here, that's where my daughter's spleen is. And that is the end of my GI system. Thank you.